super duper chiropractic workshop. Even Dr. Adnan had worked more than 3 days to uh, make the certificates and all. So that was very good, and I'm very happy for the good response. So today again we are going to give a presentation. It's not being a presentation, it's being a interaction between you people and me, that how we are doing the advanced techniques, how we are using the advanced physiotherapy to get very good result in very less time. That is the demand of nowadays. Even Dr. Adnan had shared a message from a patient. He was demanding for the dry needle therapy. They are searching different things on the Google. They are studying about their diseases, their problem, and as per the problem they are searching about the best thing, because everybody wants the best thing. Even if I have any problem in my teeth, in my stomach, then I will find the best doctor who will give the best result in less number of time. That is the demand. Nobody is having the time to spend 3 months, 4 months for the physiotherapy. Just before 3 years or 4 years, people used to go for the physiotherapy for low back pain for even 4 months, 3 months. And the our physiotherapists, they just go for the ultrasonic therapy, the tense therapy, the deep heat, and then some exercises. Now, even some patient says that whatever machines you are using, we can use that machine also. We know the exercises better than you. We know the better exercises better than you. Then what's the difference between you and me? So nowadays, it's very, very important to upgrade yourself. To upgrade yourself, because as we had seen one movie, that Three Idiots movie, that he was saying that life is a race. So everywhere there is competition. Everywhere there is competition. Even I'm sitting in Lucknow. So more than 15,000 physios are working in Lucknow. So to be the best among them, we have to work very hard. We have to upgrade ourselves. Even now, I used to upgrade myself. I had taken more than 64 workshops before starting teaching. From 5 years, I'm teaching the students. And for teaching purpose, I have to upgrade myself. I have to take different workshops. I have to take different webinars just to upgrade, as you people are doing. So it's very important to upgrade yourself. That's why we have different short courses. As not in BPT, not in MPT, we are able to do the special techniques, special things, just like chiropractic adjustment, just like cupping therapy, just like dry needle therapy, taping therapy, ISTM and ETC are there. So after completing the bachelor, after completing the masters, we have its requirement of the field that you have to upgrade. That's why we used to go for different webinars and different workshops. Thanks to Dr. Adnan for organizing this free webinar for you people. I'm just going to give the introduction about the dry needle therapy, what exactly dry needle therapy is, and how it is being useful for our day-to-day life, for our patients, and how we can get the good result by using the dry needle therapy. Before starting the PPT, I will go for the 3-minute introductory video, which is already uploaded in my YouTube channel. You can access it, but it's a good video. I like that video. So it's a 3-minute video. That video is in Hindi, but I will communicate my PPT in English. Don't worry about it. Just a small thing I want to say, that last webinar I had gone through, you people had gone through about the chiropractic adjustment. So what's the difference between chiropractic and dry needle therapy? So the benefit of dry needle therapy is that where we can't go for the chiropractic adjustment, we can go for the dry needle therapy. It's the beauty. For example, post-operative cases. Dr. Adnan, I'm audible?
Yes, sir, of course.
I'm audible, na? Voice is
Yeah,
clear?
it's good, sir.
Okay,
Those who are
okay.
not getting, they should check your internet connection.
So the beauty of dry needle is that where the condition in which the chiropractic adjustment is contraindicated, we can go for the dry needle therapy. I used to prefer for the chiropractic adjustment because it's the demand of the nowadays it's the in boom, and I am internationally certified chiropractor. So I used to go for the chiropractic adjustment for mostly patients. But in the cases where chiropractic is contraindicated, we can easily go for the dry needle therapy. For example, the post-operative cases. For example, post-operative cases in which we can't go for the adjustment. We can't go for the adjustment. In that case, we can easily go for the dry needle therapy. For example, TKR, THR. Nowadays, every orthopedic surgeon go for the THR, and after that rehabilitation is required. In THR cases, in TKR cases, total knee replacement, total hip replacement, even after the reconstructive surgeries, it is rehabilitation is required, and dry needle plays a very big role in that cases. If anybody got ankle sprain, ankle strain, so ankle sprain or ankle strain or recent injuries where chiropractic is contraindicated, we can easily go for the dry needle therapy. In open wound, in healing, for healing purpose, for any suture, for any recent traumatic injury, we can go for the dry needle therapy, and we get a very good result by applying the dry needle therapy. So before starting that, I would like to go for this small video, 3-minute video. It's very good video. After that, we will go for it. Just go through it. नमस्कार दोस्तों, मैं डॉक्टर पुनीत चौबे डिवाइन टच फिजियो एंड रिहैब एकेडमी से आपसे बात कर रहा हूँ। हमारी ये जो संस्था है, ये फिजियोथेरेपी और बाकी मेडिकल ग्रेजुएट्स को अपग्रेडिंग करने के लिए स्पेशल कोर्सेज हम चलाते हैं, जिसमें ड्राई नीडल थेरेपी का कोर्स लेते हैं, कायरोप्रैक्टिक एडजस्टमेंट का कोर्स लेते हैं, वर्कशॉप्स हमारी चलती हैं, कपिंग थेरेपी पे लेते हैं, मैनुअल थेरेपी पे लेते हैं, स्पाइनल रिहेबिलिटेशन के ऊपर वर्कशॉप्स लेते हैं। लगभग पिछले 2 साल में हमने 2000 से ज्यादा स्टूडेंट्स को पढ़ाया है और काफी सक्सेसफुल हमारा ये वर्कशॉप्स रहे हैं। प्लस ऑनलाइन मोड, ऑफलाइन मोड दोनों से पढ़ाते हैं। हम दिल्ली भी जाते हैं, बॉम्बे भी जाते हैं, लखनऊ में भी सेमिनार्स लेते हैं, इम्फाल लेते हैं, और ऑनलाइन क्लासेस भी चलते हैं। प्लस इसमें जो भी लोग आकर के जुड़ते हैं हमसे, उनमें कोशिश यही रहती है कि उनको अच्छे से अच्छा हम नॉलेज दे सके, बढ़िया से बढ़िया काम करके दे सकें, और ज्यादा से ज्यादा उनको हम नॉलेज दे सके, उनके अपग्रेडिंग कर सकें। बहुत बहुत धन्यवाद आपको, बहुत बहुत धन्यवाद। आज मेरा दिल खुश हो गया सर की है ना, टेक्निक लिख के और प्रैक्टिस करके उस बात को यार मैंने प्रैक्टिस किया। जहाँ तक मैंने स्टडी किया है chiropractic, वेरी फास्ट, ठीक है, बट शॉर्ट पीरियड में सर ने तो समझाया है ना, मतलब सिर से लेकर के पैर तक, डीप है। मैं एक्सप्लेन नहीं कर सकता, क्योंकि अगर एक्सप्लेन करूंगा तो पूरा 1 घंटा लग जाएगा, बट इतना अगर मैं शामिल कर दिया है और बहुत शॉर्ट पीरियड में इतना अच्छा एक्सप्लेन करके बताया है कि मतलब इसका बेनिफिट तो आप लोग लेंगे ही लेंगे, मैं तो दूंगा। बट थैंक यू सर, चौधरी सर को बहुत थैंक यू, इतना अच्छे टीचर ऑर्गेनाइज किया हमारे। थैंक यू सर, डॉक्टर पुनीत चौबे। Thank you so much, sir. I think a really great job. Super, sir. Sir, ये तो मेरा ये आपसे गुजारिश है कि ज्यादा से ज्यादा आप लोग हमसे जुड़िए, और जो हमारे वर्कशॉप्स हैं उनको अटेंड करिए, और एक जो अपॉर्चुनिटी है उसको अवेल करिए, प्लस अपने नॉलेज को अपग्रेड करिए और सक्सेसफुल होइए। जय हिंद, जय भारत। So it's my small introduction. I'm masters in physiotherapy with having more than 22 years of clinical experience and 6 years of academical experience. From past 6 years, I am taking different workshops across the country. The good thing in our workshop is that we use more of the clinical knowledge. And in our clinical practice, it is very important to use 90% of the practical knowledge, which is very important because we have to give the best to the patient. The patient is not asking about your award. The patient is not asking about your gold medal. He just want to be get cured, and he just want to get the best result in single sitting or double sitting. Now, without wasting the time, we are going to start the webinar. So in today, we are going to describe about the dry needle therapy. Dry needle therapy, it is known as dry needle therapy because there is no medicine, no painkiller, no steroid is used in dry needle. And that's why it is used as dry needle therapy. In sports, it is being more used in sports countries such as Australia, in China. They use more of the dry needle therapy. In India also, nowadays we are using more of the dry needle therapy. And it plays a very big role in acute injury, to reduce the pain, to reduce the swelling, to reduce the spasm, and to promote healing, to increase the blood flow. It is very useful. So here it is written as sterile single-use dry needle therapy or acupuncture needle. It means that it is sterile needles and it is used for single use. We can't use it for another patient or even for the same patient. If you are not able to insert the needle properly, don't repeat it again and again because it will create the infection and you will also get the infection. So to prevent the infection, you have to sterile your hands, you have to sanitize your hands, wear the gloves, and after that, use the single-use sterile needle. There are different sizes of the needle is available as per the requirement, as per the requirement of the patient, as per the diagnosis. So last webinar, I had told you to make the diagnosis. That is very important. You have to do the proper assessment of the patient. That is the need of the hour. As I told you, 15,000 physios are working in Lucknow. So Lucknow is a very big city. More than 15,000 may be working there. Every year there are different colleges and their new physios are coming out in the market and they are doing the competition with us, or not only us, everywhere there is competition. So how you will differentiate you from different physios who are working the market? Just by doing the good assessment, just by doing the proper diagnosis of the patient and applying the good technique. If your assessment is good, if your technique is good, if your diagnosis is perfect, then anybody can use the dry needle therapy. Anybody can use the TENS therapy. Anybody can use the SWD. Anybody can use the any machine of the physiotherapy. But the difference between them and us is that our diagnosis is correct. Our differential diagnosis is very important. We have to do the proper differential diagnosis. As shoulder pain, there is n number of cases for the shoulder pain. In low back pain, there are 100 causes of the low back pain. Listhesis may be there. There may be nerve compression. There may be disc involvement. There may be simple spasm, there may be scoliosis, there may be any postural problem, mechanical low back pain. So more than 100 causes of low back pain is there. So as per the assessment, you have to do the proper diagnosis. You have to make the differential diagnosis also and do the treatment. What is dry needle? It is a technique of inserting small filament needles into muscle trigger point to treat myofascial pain and dysfunction. As I told you, we are seeing more of the musculoskeletal disorders. So we are doing the neuromuscular dry needle therapy. It is the being differentiated from acupuncture. In acupuncture, we used to do the treatment for the deformity, dysfunction of the liver, any visceral organ. But in dry needle therapy, we mostly go for the musculoskeletal problem. Neuromuscular dry needle therapy we used to do to treat the different muscular problem or joint problem. It can be used to treat headache, frozen shoulder, tennis elbow, muscle spasm, fibromyalgia, sciatic pain, hip pain, knee pain, repetitive strain injury, acute and chronic pain. There are different causes, different diseases that can be easily cured and easily treated by dry needle therapy. So dry needle involves inserting an acupuncture needle into a trigger point, and it is typically used to treat the pain associated with injuries. A trigger point is a tender spot in a tight band of muscle which causes pain, and when pressed or squeezed, just like it's a jump sign. Jump sign हम बोलते हैं यहाँ पे, अगर हम स्क्वीज करेंगे तो पेशेंट अचानक से जंप करेगा. वहां पे बेसिकली क्या हो रखा रहता है कि एक ट्रिगर पॉइंट बना रहता है. देयर इज अ ट्रिगर पॉइंट. और हम ड्राई निडल थेरेपी में क्या करते हैं कि एक न्यू हमने ब्रेन को एक सिग्नल दिया जो कि ड्राई निडल के थेरेपी के थ्रू दिया, ड्राई निडल इंसर्ट किया तो देयर विल बी ए न्यू सिग्नल विच इज गोइंग टू द ब्रेन एंड इट विल ब्रेक द चेन, इट विल ब्रेक द आर्क, इट विल ब्रेक द चेन and there will be relaxation in the muscular spasm. They often occur as result of neuromuscular dysfunction and in areas of the musculoskeletal stress. Everyone has a trigger point, but when they are deactivated, it can allow more efficient movement, increase flexibility and lead to a decrease in pain. सबको मस्कुलर स्पाज्म बनता ही बनता है और ट्रिगर पॉइंट बनता ही बनता है, ऐसा कोई आदमी नहीं है जिसको कि ट्रिगर पॉइंट ना बनता हो। अगर हम 3 घंटे के लिए बैठ करके एक मूवी देखते हैं, देयर भी इज चांसेस ऑफ गेटिंग मोर थाउजेंड ऑफ द ट्रिगर पॉइंट बनते हैं और रोज रिजॉल्व भी हो जाते हैं। कुछ ऐसे ट्रिगर पॉइंट हैं जो कि बने रह जाते हैं, वहीं पे हमें प्रॉब्लम होती है। आई विल
Sir,
स्पीक इन।
please share your PPT, sir.
यस सर, पीपीटी इज देयर। सो
PPT. It's
हाँ,
no, it's showing your YouTube, sir.
यूट्यूब।
Please share again your screen. Again, sir. Now again PPT, sir.
नाउ इट इज
Yeah,
विजिबल।
started. Yeah, started.
ओके ओके।
Thank you. Unmute yourself, sir.
It already muted, sir.
Okay, sir. Now we can proceed, sir.
PPT is showing.
No, sir. Yes, showing, sir.
Okay, okay.
Showing.
So now it is visible, sir.
Yes, sir. Yes, sir.
Okay, okay. So this is the needle in which there is single-use sterile dry needle therapy. I will explain again. And there is a lock. Lock is there. So we have to remove this lock before inserting the patient. And it is very, very important to tell the patient that we are using the single-use sterile needle. And it is advisable to open the packet in front of the patient to gain the confidence of the patient. Just tell the patient, sir, we are using the single sterile needle and we are opening in front of you. It will just build the confidence of the patient. Anybody wants that, you should use the sterile dry needle therapy. So I had already told it is a technique of inserting small filament needles into muscle trigger point to treat myofascial pain and dysfunction. It can be used to treat headache, shoulder, tennis elbow, muscular response, fibromyalgia, sciatic pain, hip pain, knee pain, repetitive strain injuries, and acute and chronic pain. Anybody wants to take the picture, they can take the picture, or I will share the PPT in the group also. So you can see this is the photo, this is the picture of the back in which there are the red dots which shows the trigger point. So these are the more and more trigger points we have every day. We have more and more, it can be more 100 or 200 trigger points are there and it will be resolved by themselves. Dry needles involving inserting and acupuncture needles, ये बता ही दिया आपको. They often occur as a result of neuromuscular dysfunction and in areas of the musculoskeletal stress. Everyone has trigger point, but when they are deactivated, it can allow for more efficient movement, increase flexibility, and lead to a decrease in pain. So dry needle is an invasive procedure which involves inserting a thin filament needle into the skin and muscle directly at a myofascial trigger point. The evidence-based dry needle in various areas of physiotherapy has increased instantly over the past decade. अभी कुछ दिनों में dry needle therapy बहुत ज्यादा बूम पर हो गया हमारे physiotherapy में. Dry needle can be used for a variety of musculoskeletal problem. Neuromuscular dysfunction and imbalances are thought to be a primary contributing factor of the symptom. अभी मेरी फोटो दिखाई दे रही है सर? मैं विजुअल हूं?
Yes, sir. Yes, sir.
मैं
Both
मैं भी
both are visible.
मैं भी दिखाई दे रहा हूं?
Yes, sir. Yes, sir.
ओके। सो होता क्या है कि जब भी हम कुछ भी काम करते हैं तो देयर विल बी कॉन्ट्रैक्शन एंड रिलैक्सेशन ऑफ द मसल्स। मसल्स का कॉन्ट्रैक्शन हो रहा है, रिलैक्सेशन हो रहा है, ये कॉन्टिन्यूअस चलता रहता है। कई बार ऐसा होता है कि जो हमारी मसल्स कॉन्ट्रैक्ट कर रही है, रिलैक्स कर रही है, उसी पोजीशन में वो स्टक कर जाती है और वहां पे हमारे ट्रिगर पॉइंट्स बन जाते हैं और वहां की टोन बढ़ जाती है। उस केस में व्हाट वी हैव टू डू, वी कैन यूज द ड्राई नीडल थेरेपी एंड वी कैन गो फॉर द taping therapy which helps to reduce the spasm and it will reduce the pain also. So trigger point कैसे रिलीफ होता है? ए ट्रिगर पॉइंट इज एन एरिया ऑफ एलिवेटेड न्यूरोलॉजिकल एक्टिविटी, जहां पे न्यूरोलॉजिकल एक्टिविटी बढ़ी हुई है, लोकेटेड इन द मसल और फेशिया, दैट में रिफर ए पेन इन ए लोकलाइज्ड और पेरिफेरल मैनर. These trigger points are believed to be the result of motor neurons becoming stuck in a feedback reflex arch. जैसा कि मैंने बताया कि वो स्टक कर गई मसल और वहां पे रिफ्लेक्स सेक्शन बढ़ जाता है, जिसकी वजह से ट्रिगर पॉइंट बन जाते हैं, फैसिलिटेटिंग मसल स्पाज्म, और वहां पे मस्कुलर स्पाज्म बन जाता है. सॉरी. मस्कुलर स्पाज्म जो है, दैट इज इनवॉलेंट्री कॉन्ट्रैक्शन ऑफ द वॉलेंट्री मसल. जो हमारी मसल्स का इनवॉलेंट्री कॉन्ट्रैक्शन है, दैट इज कंट्रोल्ड बाय द स्पाइन ओनली. वो ही हमारा मस्कुलर स्पाज्म होता है. जैसे कि हम बचपन में देखते थे, एक छुई मुई का पेड़ रहता था, जिसको हम टच करते थे तो वो कॉन्ट्रैक्ट कर जाता है. जस्ट लाइक द ऑल मूवमेंट विच इज कंट्रोल बाय द स्पाइन, दैट इज नोन एज रिफ्लेक्स मूवमेंट. रिफ्लेक्स कैचेस का नाम आपने नाम सुना होगा. जब हम क्रिकेट में देख रहे हैं कि एक रिफ्लेक्स कैच है विकेट कीपर के पास में और उसने रिफ्लेक्स कैच लिया, दैट ऑल इज कंट्रोल्ड बाय द स्पाइन ओनली. सो स्पाज्म इज आल्सो कंट्रोल्ड बाय द स्पाइन. इंट्रोड्यूसिंग ए न्यू स्टिमुलस, दैट इज द निडल. निडल हमने लगाया, implants the reflex arc and has the effect of relaxing the muscle. वो जैसे ही हमने एक निडल वहां पे इंसर्ट करी, एक न्यू हमारा चैनल क्रिएट हो जाता है. जैसे कि हम कोल्ड थेरेपी देते हैं, आइस थेरेपी देते हैं, उस तरीके से हम ड्राई निडल थेरेपी यूज कर रहे हैं, तो एक न्यू आर्क बन जाता है, और वो जो आर्क बना हुआ है जिसकी वजह से स्पाज्म हो जा रहा है, वो ब्रेक हो जाता है. कई बार ऐसा डिस्कशन होता है कि ड्राई निडल सेफ है कि नहीं है. देयर आर द पीपल हु सेज दैट ड्राई निडल इज गुड, सम आर अगेंस्ट ऑफ द ड्राई निडल थेरेपी. स्टडीज हैव shown that it is has the same effect as the placebo treatment, but it's not like that. In my personal experience, dry needle plays a very big role for treating the acute cases, for ankle sprain, for any acute pain, even in chronic cases also, osteoarthritis, frozen shoulder, chronic low back pain, dry needle plays a very big role. And even in cases of spinal canal stenosis also, where different therapies phased, you have it's very difficult to manage the spinal canal stenosis, and that can be easily manageable by the dry needle therapy. It mimics acupuncture but requires much less training. It's not like that. In every therapy, you have to require the training is must. Training is required. Somebody says that it is very easy to use the dry needle therapy, you can easily use it, but it's not like that. It looks very easy to do the dry needle therapy, but where to use, how much to use, and how the method, which method is should be applied, that is very important. There are different method of applying the dry needle therapy. You should know the different method, how to apply it in 90-degree, how to apply it in 45-degree, how to apply it in 180-degree. Because in just for example, here is our upper neck pain. Patient are coming from the upper thoracic pain and lower neck pain. There is just below this, our apical lobe is there. Some patient is having the trapezitis, they are having the trapezius pain, and anybody can insert the dry needle therapy 90-degree, they will rupture the lungs. In our thoracic pain, if anybody is coming with the thoracic pain, just below the thoracic belt, there is our lungs is there, our lungs is there. So they can easily rupture the lungs and the patient may collapse. So please be very careful before applying the dry needle therapy to any of the patient. Okay. So technique, material required, gloves, you should use the proper gloves, sterile needle, the part which is going to be treated should be sterile, and there should not be any infection in the skin should be soft, and infection less skin should be there, less hairy. If hair is there, just ask the patient to remove the hair. Technique, we have to find the trigger point, insert the needle into the tissue, and feel the twitch response. It's very important to feel the needle which is being inserted. So these are the cases in which dry needle is being used. For example, this is the case of burn. Generally, we can't go for any physiotherapy for burn cases, but dry needle plays a very big role for healing of the burn cases. For burn tissues, we can use the dry needle therapy across the boundary of the burn tissue. Burn tissue के across the boundary हम use कर सकते हैं. It will promote the blood circulation, it will promote the healing, it will improve the healing very fast. You will get the good result in burn cases. Next, in tennis elbow cases, the tennis elbow is basically lateral epicondylitis. So we used to see a lot of cases in our daily practice for the tennis elbow. So in tennis elbow, if you are going to use the dry needle therapy, you just have to use one dry needle therapy on the trigger point, that is lateral epicondyle. Just insert a single needle and you will get the magical result. I had seen a lot of patient who just got cured by single setting, or in one or two setting, they get fully cured by dry needle therapy. Just inserting a single needle. You just have to find the proper trigger point and just insert the needle. You will get the best result. Osteoarthritis is just now. Osteoarthritis is basically degeneration of the bone. There is degeneration, there is reduction of the joint space, but dry needle therapy improve the blood circulation. It can increase the muscle strength, as we can use the dry needle therapy to reduce the spasm, as well as we can use the dry needle therapy to increase the strength of the muscle. We can use the we can increase the tone of the muscle, and as well as we can decrease the tone of the muscle as per the requirement of the patient. Such as in paralysis cases, yes, dry needle therapy is used in paralysis cases. In hemiplegia cases, yes, we can use the dry needle therapy in hemiplegia cases. And after that, we can go for the stimulation. We can apply the electrode stimulation is there. It will deeply stimulate the muscle, and there will be contraction of the deeper muscle fiber, and you will get the result. You have to apply the proper technique. We can reduce the pain, we can reduce the spasm, we can reduce the tone, and we can increase the muscular tone also. For strengthening exercises as required in many cases, for osteoarthritis cases or any low back cases or any frozen shoulder cases, where you are in the second phase of rehabilitation. First phase of rehabilitation is to reduce the pain, to reduce the swelling, and in another second stage of the rehabilitation, our target is to strengthen the muscle. Our target is to increase the tone of the muscle. In that also, just apply the dry needle therapy and ask the patient to go for the exercises. You can go for the strengthening exercises after applying the dry needle therapy. You will get the faster result. Just see one video is there. Mm, I'll show you one video. At last, I will show you the video. That is the osteoarthritis case, how we are getting the result in osteoarthritis case. So now PPT is showing, sir. PPT is visible. Adnan.
Yes, sir. Visible, visible.
So in cervical spondylosis cases, we are seeing a lot of cases for the neck pain. So we can use the dry needle therapy for cervical spine pain, for lumbar spine pain, for disc bulge cases, for herniation, for even for listhesis also we can use the dry needle therapy. It is very useful and very good result are there. Post ankle fracture, not only for the ankle fracture, we have the different post fracture cases in which there is lot of swelling is there, lot of complication is there, lack of movement is there, the joint is being unstabilized for 1 month or 2 months. After removal of the plaster cast, dry needle therapy can be used to reduce the swelling, to reduce the pain, to reduce the inflammation, and to promote healing. So we can use the dry needle therapy for post fracture cases. Hip AVN cases, that is avascular necrosis is there. In avascular necrosis cases, we can go for the dry needle therapy. Here, I just want to say that in avian cases, there are different stages of the avian: grade 1, grade 2, grade 3. In grade 3, the reconstructive surgery or hip joint replacement is required. We have to go for the THR, but before grade 3, we can go for the dry needle therapy that can increase the blood flow, and by using the dry needle therapy and using the good exercises, we can improve the hip AVN cases also. Lumbar area pain, sciatica, disc bulge herniation, we can use the dry needle therapy. That is very effective. We can get the good result in that cases. lumbar disc bulge, there is, we in our clinical practice we see a lot of cases for the disc bulge or in the lumbar area, so we can go for the dry needle therapy. After doing the chiropractic adjustment, if you are a chiropractor and you are doing the good chiropractic adjustment, after doing the chiropractic adjustment, go for the dry needle therapy, go for the cupping therapy, go for the taping therapy. That will help you a lot. Yes, in Bell's palsy, that is facial palsy, the paralysis of the seventh cranial nerve. Uh, in physiotherapy, we have a lot of cases who are suffering from the cerebral Bell's palsy, that is facial palsy. And before the dry needle therapy, the therapist used to go for the rehabilitation process for 1 month, 2 months, or even for 3 months also. But nowadays, if you are using the dry needle therapy, the advanced physiotherapy, and you can use the taping therapy also, you will get the result in a week, in 10 days or in 12 days, you will get the good result in Bell's palsy. I had seen a lot of cases who are having the Bell's palsy and facial palsy, and we get the result in 10 days only. 10 days, there is full recovery. It's very good thing that the patient is getting full recovery in 10 days for the Bell's palsy. It's a very big achievement. So you can use it. Post TKR cases, as I had told you in the starting of the PPT, that after any TKR, after any THR, or we have the ACL reconstructive surgeries or knee ligament reconstructive surgeries. So after TKR, after THR, or any reconstructive surgeries, we can go for the dry needle therapy. It will help to promote the healing. It will help to reduce the swelling, and it will help to improve the range of motion also. Trapezitis cases, nowadays everybody is using the laptop and computer and having the neck pain. They are having the severe neck pain, severe back pain. So you can go for the dry needle therapy and taping and educate for the posture correction. The patient will get the result in single sitting, or he will get the result in 2 sittings only. Wound healing. See, this is the case which had came to my center just before my center. There was a road traffic accident, and after cleaning of this wound, I had gone through the dry needle therapy. In 2 or 3 settings, we had seen the changes in the wound. There is great healing. ACL reconstruction, as I had already told you, so we can go for the reconstruction of the ACL injury before surgery also and post surgery also. In both the cases, dry needle therapy plays a very big role. We have seen a lot of patients who have the ACL injury, grade 2, grade 3, meniscus tear, different ligament injuries there, sports person is there, footballers are there. And doctors had advised to go for the reconstructive surgery. Before reconstructive surgery, they had visited my clinic. So I had asked them to wait for 1 week or 2 weeks, just go for the dry needle therapy and some advanced physiotherapy. We will see the result. And there are a lot of cases who had been documented in my clinic that they got the good result and they got the full recovery. Surgery, they don't require the surgery. Without surgery, they got the result. So in ACL injury before surgery, you can go for the dry needle therapy, which plays a very big role. And after surgery, also for the rehabilitation purpose, post surgery, you can also go for the dry needle therapy. In both the cases, we can go for the migraine treatment. We see a lot of patients who are having the migraine. There is the C2 vertebra is involved. So we can go for the adjustment, chiropractic adjustment. We can go. If you don't know the chiropractic adjustment, you can go for the dry needle therapy. We'll apply the dry needle therapy over here. Single sitting or one more sitting, in 2 sittings, it will be vanished away. The patient who are suffering from the migraine from past 6 months, suppose any patient used to visit your clinic and he is having migraine from past 6 months, 7 months, 8 months, and you just done one single sitting, he got the full relief. So what will be his expression? He will be very good and he will say that, Doctor Saab, you had done the magic for me. It's a magical result. So that's why dry needle is also known as the magical therapy. Heel pain. Heel pain can be described with different kind of heel pain is there. First is plantar fasciitis, second is calcaneal spur, third one is heel spur. So in both the three, in all three cases, whether it is plantar fasciitis, whether it is calcaneal spur, or in the fat pad syndrome, we can go for the dry needle therapy and it gives the good result in heel pain. I had seen a lot of cases who got the good result in heel pain. See, this is the film of one patient who had visited my clinic post burn cases. This is the day one. I had applied the dry needle therapy. In recent injury or any open wound, don't apply the dry needle therapy on the surface of the wound. Apply the dry needle therapy on the boundary of the wound. Here we had already healed. There is the healed wound. Wound is already been healed. So I'm just applying the dry needle therapy on. We can apply on the this structure. But if there is open wound, so don't apply it on the open wound. Just go for the boundaries. Just across the boundary, if you will use, then also you will get the good result. This is the day two. See, in single day, there is a big changes in the skin. Very big change. There is the redness is there. There is improved healing. Blood circulation is there. So in single day, there is a magical result in burn cases. Piriformis syndrome. There are a lot of cases in our clinical practice where we see a lot of patients who are suffering from the tight piriformis syndrome, tight piriformis muscle, and we are not able to do the differential diagnosis. We just say that there is the lumbar disc bulge or lumbar pain is there. So there is the tightness of the piriformis muscle. So release that muscle and go for the dry needle therapy. Single visit or second visit, you will get the full result. Sciatica. As in sciatica, we see there is compression of the sciatic nerve. So you can go for the dry needle therapy. It will improve the blood circulation. It will improve the nerve also. Not only on the lumbar area, you can go for the dry needle therapy across the root of the sciatic nerve. In the thigh, in the calf muscle also. So you can go for the dry needle therapy, and after applying the dry needle therapy, you can go for the stimulation of the dry needle therapy. When you are going to attend my offline workshop, I will tell you how to stimulate the nerves by applying the dry needle therapy. Dry needle therapy apply करने के बाद में कैसे nerves को stimulate करेंगे, ये मैं आपको अपनी workshop में, offline workshop में बताऊंगा. ये है हमारी dry needle therapy. इस तरीके से हम insert करते हैं और we get the result. Dry needle therapy should be avoided in the patient under the following circumstances. The patient with needle phobia, there are a lot of patient who is having the needle phobia. Don't go for the dry needle therapy. Consult of the patient is very necessary. Just ask the patient कि we are going to insert the dry needle therapy. If he is agree, then only go for the dry needle therapy. पेशेंट अनविलिंग, पेशेंट अगर फियर है, वो अनविलिंग है, उसको मन नहीं कर रहा है, तो डोंट गो फॉर द ड्राई नीडल थेरेपी. अनेबल टू गिव द कंसर्ट, उससे कंसर्ट लेना है. एज रिलेटेड फैक्टर, अगर बहुत ज्यादा जीरियाटिक एज का पेशेंट है, ही इज नॉट कोऑपरेटिव विद यू, मोर देन 65 ईयर 70 ईयर ओल्ड पेशेंट, अवॉइड ड्राई नीडल थेरेपी इन दैट केसेस. Medical emergency or acute medical condition. As in the starting of the PPT, I was telling you people that dry needle plays a very big role in acute cases. It doesn't mean that in acute medical emergency, you are going for the dry needle. Some patient is having the cardiac arrest, just go for the dry. No, my dear, in road traffic accident, just ask the patient to go to the hospital. In any medical emergency, just go for the hospital for the proper checkup. In acute injury means acute sprain, acute low back pain, acute shoulder pain, acute wrist pain, acute elbow pain. In that cases, go for the dry needle therapy. But in any emergency cases, just refer the patient to the hospital. ओवर एन एरिया और लिम्फ विद लिम्फोडीमा, लिम्फोडीमा अगर कहीं पर है, रिस्क ऑफ इन्फेक्शन है, सेलुलाइटिस है, वहां पे ड्राई नीडल थेरेपी हमें नहीं करना चाहिए. अगर हम ड्राई नीडल थेरेपी करेंगे, इट विल इंक्रीज द इन्फेक्शन. द इन्फेक्शन विल स्प्रेड फ्रॉम वन प्लेस टू अनदर प्लेस. इनअप्रोप्रिएट फॉर एनी अदर रीजन. कोई ऐसा रीजन है जिसमें ड्राई नीडल नहीं करना है, वहां नहीं करेंगे. Abnormal bleeding tendency, if there is a abnormal bleeding tendency, avoid dry needle therapy in that area. Compressed immune system, is there is decreased immune system, avoid the dry needle therapy. Vascular diseases hai, never go for the dry needle therapy. Diabetes, if the patient is having blood sugar more than 200, fasting blood sugar is more than 200, then don't do dry needle therapy. Ask the patient to go for the medication. If the fasting blood sugar becomes lesser than 200, then go for the dry needle therapy. In pregnancy, dry needle therapy is contraindicated. In the children between below 8 year, below 10 year, below 14 year, avoid dry needle therapy. In some cerebral palsy cases, if there is severe spasm, is there severe spasticity, some people use the dry needle therapy, but please avoid dry needle therapy in children. Weak patient, feral patient, don't go for the drainal therapy. Patient with epilepsy, any neurological symptom, any neurological problem, Parkinson is there, neurological deficit is there, patient is not neurological fit, then never go for the drainal therapy. Psychological status, patient is not psychological fit, then never go for drainal therapy. Any kind of allergy, so don't do drainal therapy. Patient medication, if any kind of medication which is not suitable for any kind of needle therapy or any kind of physiotherapy, then don't go for the dry needle therapy. Unsuitable patient for any reason, don't please avoid dry needle therapy. Assess range of motion, restriction and pain uh, before applying the dry needle therapy. Give a patient a stretching program after dry needle therapy, and you can go for different modalities also. After dry needle therapy, anybody can go for the hot pack, anybody can go for the cold therapy to increase the blood circulation to promote healing. So PPT is over. I will try to show you one video. Screen is visible, sir? Anand, sir?
Yes, sir. Yes. Screen is visible.
Okay. We are now using the triangle for osteoarthritis case, which is very important. We see a lot of cases for osteoarthritis.
We can have question answer at last.
सर
Let's.
सर वीडियो दिख रहा है?
नहीं दिख रहा है सर.
वीडियो नहीं दिख रहा है?
नहीं दिख रहा है.
ओके. Analysis of knee joint is very important, and we can use the driving therapy to stimulate the muscle, to increase the blood flow, to stimulate the muscle also, the power of muscle.
Yes,
अभी
sir.
दिख
It's
रहा है?
getting visible. It's getting
वीडियो दिख रहा
visible.
है?
Yes, sir.
वॉइस आ रहा है सर?
Yes.
And tonify the muscle by using the drainage therapy. This is the packet. We have to open this. We are using the glove where we had already sanitized the part. This is the dry needle therapy, which is single use sterile dry needle therapy. So why it is called dry needle? Because we don't use any medicine, any painkiller is not there. It is, that's why it is known as dry needle therapy. We are just opening the packet. There is lock is there. There is these are the single use sterile needle. So there is the lock is there. We have to place the needle on the part which we have to apply the needle, then remove this lock, and then we will tap it. So we can use the needle. It's very, very, very effective. पहले से कैसा है सर, थोड़ा बताइए कितना इम्प्रूवमेंट, हाउ मच इम्प्रूवमेंट इज देयर?
पहले से काफी अच्छा है, करीब 40-45% हमको आराम मिला है और पेट किलर भी हमारा बंद हो गया है, बिल्कुल आज तक दिन से नहीं खा रहे हैं.
बहुत बढ़िया, वेरी गुड. आप नीडल कर रहे हैं, इससे बहुत आराम मिल जाएगा आपको. ठीक है,
काफी आराम मिला है, बहुत अच्छा है.
अब दिखा दो, वीडियो दिखा दो. So we had seen that it was a case who is having 75-year-old man, and he got relief by dry needle therapy. One more video was there. So we can go for this. So we can use the dry needle therapy, which is very effective in low back cases. This bunch, sciatica, herniation, radiation, it is very useful, and you can use it in different cases. And as already I told you, this is a single use sterile needle, but very effective in low back cases, cervical spondylosis cases, lumbar spondylosis cases, disc bulge, herniation, any kind of nerve condition, even in the power, is very effective, very, very, very effective. Very, very good. So different methods of the therapies in spinal cases, how to apply it in ligament injury, how to apply it in osteoarthritis cases. We can apply the 90-degree position, then 45-degree, then 180-degree. There are the different techniques how to use it. In my workshop, when we go for the online workshop, I will explain each and everything. You have to do that. So in our upcoming workshop, I will going to tell you how to use the proper tool, how to use the proper needle, and in which cases how to do the technique, which technique should be applied, and how to do the assessment of the patient, and how to get the result. Thanks from my side. Over to Adnan sir for further things.
Now you can ask a question to the sirs and clarify your doubts. Single, one by one. I will unmute you people. You can. Try anyone now. Unmute yourself. Try yourself to unmute.
Hello, sir. Good evening, sir. Hello.
Good evening. Boliye.
Yes, it's the durations of the treatment time, sir.
Good question. Duration of the treatment, it depends upon the case, whether it is acute case or chronic case. Generally, in chronic cases, we go for the dry needle therapy for 20 minutes or 25 minutes. In acute cases, we go for the dry needle therapy for 10 minutes or 15 minutes. Depends upon the case and as per the requirement of the patient. So, as I already told you, in chronic cases, 20 minutes, 25 minutes is more than enough, or for acute cases 10 to 15 minutes is more than enough. Thank you.
Is there any position for the needling, sir? Like because you should put the sciatic pain in 60
Yes,
degrees
there
and
are
90
different positions
degrees.
because there is chances of getting the nerve damage. So for if I will consider about the spine, for the spinous process, always go for the 90-degree position. For the facet joint, go for the 45-degree position. For any trapezitis or any thoracic pain, go for the 180-degree. If you will attend our workshop, I will explain you each and everything. See what happens. This is a introductory webinar is there. Just we are giving the slight introduction that what we are doing, how we are going to teach the candidates. When you are going to attend our offline workshop, that is the full day workshop from 10 a.m. to 6 p.m. Full day we are going for the practical session for each and every cases. For osteoarthritis, how to use, for low back pain, how to use, for frozen shoulder, how to use, for which degree we have to use, for which angle we have to use, कैसे करना है कैसे नहीं करना है, each and everything we will explain in the offline workshop. It's not possible to explain each and everything in the webinar, my dear. It's just a introductory part. But even here also, if you will ask me anything, I am the kind of person who is going to give the answer for each and everything. You can ask me anything.
Thank you, sir.
Okay, welcome.
Hello, sir.
Hello.
How the dry needling improve the muscle strength and the blood circulation?
Please repeat the question.
How this dry needling improve the muscle strength and
Muscle
the blood
strength.
circulation?
Just apply the dry needle therapy for the tonifying of the muscle and go for the strengthening exercises. By applying the dry needle therapy, there will be activation of the muscular fiber. जो हमारे muscles हैं, उनमें there will be activation of the muscular fiber and it will increase the blood flow. It will increase the circulation and it will increase the tone of the muscle. Naturally, the strength of the muscle will improve. Got my point? Hello,
Good
Anjali.
evening, sir.
Got my point? Anyone else want to ask anything?
Sir,
Good evening, sir.
Good evening.
Basically, I just wanted to ask that there are certain of needles that have been used in dry needling. So, how do we decide the
How do we decide?
The of the needle, the needle
As
has
per the
different.
condition, see as per the bulk of the patient, there are different sizes of the patient, thin patient, fatty patient, and as per the structure, the knee joint, the hip joint, there is the gluteal muscle, which is heavy muscle. It requires the more of the size of the needle as per the patient and as per the structure to be treated. We decide the different sizes of the muscle. Understand?
Okay, thank you so much, sir.
Okay, welcome. Please ask, my dear, I am here to answer all the question. Ali Kalim, please ask. Tiwari, Ankit Tiwari, please ask. You are raising hand.
Good
Sir,
evening, sir.
sir, hello.
बोलिए hello.
Yes, sir, I wanted to ask that after the dry needling, some patients tend to get the analgesic effects.
Hmm?
So, for how long does the analgesic effect stays?
No, there is no
Almost
analgesia. It's just that they will got the relief after if there is increased blood flow, the toxic material is channelized out, there will be a reduction of the pain. So it's not like the analgesic effect is there. It is just the relief in the pain because there is increased blood flow. अगर हम कहीं पे भी blood flow बढ़ाते हैं, there will be vasodilatation, blood vessels का dilatation हो जाता है. अगर हम hot pack लगाते हैं, if we are going the hot pack, if we are going for the ice pack, vasodilatation. So it will increase the blood flow, the toxic materials will channelize out and patient will get relief in the pain. Understand?
Hello, good evening, sir.
Good evening.
So my question is, how many dry needling session are typically required for effective results?
Which
Like,
case you want to know?
like any particular case, if you can say.
It depends upon the case, the chronic case or acute case. If and again depends upon the particular disease, frozen shoulder or low back pain or that ligament injury. It again depends upon the particular case. You can ask me any case. So as per the case, I will describe. It will be more easy for me to describe. You can ask me for the case.
Hello. Hello, sir.
Good evening,
My
sir.
question is,
Yes,
hello.
please ask.
Hello, my question is, sir, how to scoliosis, how to treat his scoliosis?
Good. For is good question. Very good question. Scoliosis is basically a structural disturbance. There is disturbance in the scoliosis because there is the disturbance of the structure. The spine is bending towards one side, that is known as scoliosis. If the spine is going towards one side, it will give the pressure on the structure which is side of the spine, that is muscles and ligament. There will be more pressure and there will be spasm and swelling. To reduce the pain, to reduce the swelling, to reduce the spasm, we will go for the dry needle therapy, in which direction the bone is giving the pressure. And to correct the scoliosis, we have to go for the adjustment of the spine. Just go for the adjustment of the spine, and after adjustment, go for the dry needle therapy to reduce the pain and swelling of the muscular area which is involved. Understand?
Okay, thank you, sir.
Welcome.
So in wound healing, like in RTA, for example, so what are the precautions we have to take for dry needling?
For dry needle, for RTA cases.
यस सर, जैसे आपने एक केस दिखाया था, आपके क्लिनिक में आया था,
जी जी.
तो सर तो उसमें लाइक वो वुंड एरिया में तो डायरेक्टली हम इंसर्ट नहीं कर सकते, और मे बी
साइड में मैंने बताया था आपको,
करना
पीपीटी
पड़ेगा।
जब एक्सप्लेन कर रहा तो बताया था, साइड में जो बाउंड्री है उसके साइड में हम अप्लाई कर सकते हैं. इट विल इंक्रीज द ब्लड फ्लो एंड इट विल रिड्यूस द पेन एंड स्वेलिंग ऑल्सो.
यस सर, एग्जैक्टली माय क्वेश्चन था। तो बाउंड्री इज मेड अप ऑफ सेल डेब्री, सो वो तो डेड स्किन हो गया, तो उस पे करना इफेक्टिव रहेगा?
एकदम इफेक्टिव रहेगा. जो बाउंड्री जहां पे खत्म हो रही है उसके साइड बाय साइड आप करेंगे, आपको रिजल्ट मिलेगा. मैंने बहुत ढेर सारे केसेस देखे हैं, इनको बहुत अच्छे रिजल्ट मिले हैं. और अगर कोई आरटीए का केसेस होता है, उस केस में जस्ट रेफर द पेशेंट फॉर द हॉस्पिटल. हॉस्पिटल पहले जाना चाहिए, देखना चाहिए देयर इज एनी फ्रैक्चर और कुछ प्रॉब्लम, ज्यादा मेजर प्रॉब्लम तो नहीं है. कि अगर पेशेंट ठीक है, पेशेंट इज क्वाइट इनफ टू कम टू योर क्लिनिक ओनली, देन गो फॉर द ड्राई नीडल थेरेपी। ऐसा नहीं है कि हाँ किसी का रोड ट्रैफिक एक्सीडेंट हुआ, बिकॉज रोड ट्रैफिक एक्सीडेंट बहुत ही वास्ट चीज हो गया। उसमें कहाँ पे कौन सी इंजुरी है, कहाँ मस्कुलर इन्वॉल्व है, कहाँ नर्व इन्वॉल्व है, कहाँ विसरल ऑर्गन की प्रॉब्लम है, उस केस में अगर आप अपना ट्रीटमेंट खुद से करने लगोगे देन यू विल बी इन प्रॉब्लम। अगर कहीं पे रोड ट्रैफिक एक्सीडेंट हुआ है, जस्ट उसको जाने दो हॉस्पिटल, गया उधर से चेकअप करा गया है, कोई फ्रैक्चर नहीं, कोई लिगामेंट, कोई मेजर विसरल ऑर्गन का इंजुरी नहीं हुआ, कोई हेड इंजुरी नहीं है। मान लो किसी को हेड इंजुरी हुआ, कोई प्रॉब्लम हुआ, कुछ हुआ और आप ड्राई नीडल थेरेपी कर रहे हो, देन यू विल बी इन प्रॉब्लम। ऐसा काम नहीं करने का। जस्ट रेफर द पेशेंट टू द हॉस्पिटल, हॉस्पिटल से आने के बाद में हाँ सब ठीक है, ओके आ जाओ, अभी हम ड्राई नीडल थेरेपी आपको करके देंगे।
ओके,
सर
थैंक यू।
थैंक यू।
सर जी,
जी बोलिए।
ये डायबिटिक पेशेंट को दे सकते हैं क्या ट्रेनिंग?
अभी मैंने बताया डायबिटिक पेशेंट है, जिस दिन उसका शुगर, जिस दिन आप थेरेपी के लिए जा रहे हैं, द डे इन विच टुडे इज द 13th of October, you are going to apply the dry needle therapy. Ask the patient to check his fasting blood sugar. If it is less than 200, then only go for the dry needle therapy. अगर 200 से ज्यादा है तो पेशेंट को बोलो कि आप अपना शुगर लेवल कम करके आइए, उस दिन हम ड्राई नीडल थेरेपी करेंगे। बिकॉज ड्राई नीडल थेरेपी करेंगे, शुगर बहुत ज्यादा रहेगा तो हीलिंग में प्रॉब्लम आएगा, it will create problem in healing. Understand?
हाँ जी सर, थैंक यू सर,
Thank you ji,
शुक्रिया।
welcome.
Hello, sir. Good evening, sir.
Good evening sir.
Hello.
पूछिए sir, please ask.
Sir, while doing the dry needling therapy, so if any bleed has come, so should we stop it or can we
No,
continue?
there are chances of getting bleed, but very less chances of getting bleed. In if you are seeing 100
In
of the
case,
patient, then and 80 of the patient there will be no bleed. Only 20% of the patient there will be slight bleed just after the, just like the biting of the mosquito. If any mosquito is biting to your skin, some slight bleed may be there. Don't worry about it. Just ignore it.
we
Just
can
clean the
continue
area
on the,
with
sir, we
the
can continue on the same bleed side or we can just try another trigger point, sir.
sir, just try another trigger point. No, don't go for it.
Okay, sir. Okay, thank you so
Okay,
much.
thank you, thank you, thank you. It is very common. Don't worry about it. But
Okay, sir.
generally, it doesn't come. 20% cases, we don't see any bleed.
Okay, sir. Thank you so much.
Welcome, Ji.
Hmm.
Please ask. I am here to answer all the question.
Is there
Anybody else wants to ask?
Okay, sir, we'll close it now. Thank you for your wonderful webinar today. And
Thank you,
it was
Adnan ji.
nice experience today, actually. No disturbance in between because we made the registration little hard because it was in website. So unwanted
Okay.
people didn't came. So less people also, I think 260 people attended this webinar. That
Okay.
is not a small number. It was good, I think. So thank you from our side. Thank you, sir. We'll end up the meeting now.
Thank you, sir. Good night, sir. Good night.
Good night. Good night.
Thank you, sir. Thank you so much. Good night.
Thank you, sir.
Thank you, sir.